My name is Donna Volpe, and I'm a Doctoral of Nursing Practice student, and I'm here today to talk about a very important proposal that currently sits in our congressional committees right at this moment. In 2010, in a landmark report entitled The Future of Nursing, Leading Change, the Institute of Medicine recommended the removal of scope of practice barriers for the advanced practice registered nurse. This report, which was sponsored by the Robert Wood Johnson Initiative on the Future of Nursing, attempts to remove the variation in advanced nursing practice that currently exists in healthcare today. The three branches of the U.S. Armed Services, the Army, Navy, and Air Force, combat service hospitals under the direction of the Department of Defense, and the Indian Health Service, all currently recognize the full practice authority of advanced practice RNs, which includes certified nurse midwives, clinical nurse specialists, nurse practitioners, and certified registered nurse anesthetists. These expert clinicians are able to provide high-quality care to our brave servicemen and women. It's time that we recognize that our veterans deserve the same high-quality care. The Veterans Administration, or the VHA, as it is commonly called, is a leader in healthcare delivery models and recognizes that advanced practice RNs can significantly improve the current system of healthcare in VA medical centers, outpatient facilities, and other clinical sites, all of which care for an estimated 8.3 million veterans annually. More than 6,000 advanced practice RNs currently work in VHA facilities. As a result, the VA developed a nursing handbook in 2009. Within this handbook, the VA proposes that advanced practice RNs be authorized full practice privileges, making them licensed independent practitioners. This is not a new cutting-edge concept. Rather, it just allows the advanced practice RN to practice to the full extent of their education and training, an authority that many states already recognize. The primary objector to this proposal is the American Society of Anesthesiologists. These members actually point to a 2000 study of failure to rescue rates for patients who underwent anesthesia without an anesthesiologist providing direction. This report, which is 16 years old, by Silber et al., is actually a retrospective analysis based on anesthesia billing practices submitted by caregivers. It compares cases of whether an anesthesiologist was present, or a licensed physician, undirected anesthesia resident, or a certified registered nurse anesthetist for cases. There are a few reliability concerns. First, is it possible that there was an emergency that an anesthesiologist may not simply have arrived in time to attend? Second, hospitals differ in their provision of anesthesia services. And lastly, and perhaps most important, there was no distinction between non-anesthesiologist providers made. And as such, was there a difference associated in the quality of care provided by that certified registered nurse anesthetist? Or was the study simply the absence of an anesthesiologist? Current peer-reviewed research paints an entirely different picture. In a landmark study published in Health Affairs in 2010, there were no reported differences in patient outcomes when anesthesia services were provided by CRNAs, physicians, or CRNAs supervised by physicians. Another study, also published in 2010 in Nursing Economics, found that CRNAs are a cost-effective model for anesthesia services and that no difference in quality of care between CRNAs or any other anesthesia provider was found. Advanced practice RNs recognize the importance of team-based care. It is a core foundation to nursing practice, which acknowledges the expertise of different healthcare providers. This proposed policy change by the VHA, called the Improving Veterans Access to Quality Care Act, or Bill H.R. 1247, follows similar policies for advanced practice RN practice, allowing these expert clinicians to operate as licensed independent practitioners within the scope of their practice. In addition, the American Association of Colleges of Nursing, the American Nurses Association, the American Association of Retired Persons, the American Association of Nurse Anesthetists, other nursing organizations, veterans groups, and more than 40 members of Congress support this bill. As a DNP student, I am lobbying my legislators, and I urge you to consider supporting this proposal to increase access to care for our deserving veterans. Thank you for your time.